The objectives of this video are to promote greater knowledge of the organ and tissue donation process, to help people realize that few people die of brain death. Therefore, few people can become organ and tissue donors. To demonstrate how families are already dealing with a difficult situation and now must also consider organ and tissue donation. Also to show how important it is to speak to your loved ones about your intentions before you find yourself in a similar situation. Few people realize that the transplantation of a vital organ is the result of a complex and difficult process involving almost 100 people and one very grateful organ recipient. Through the story of Mr. Smith, we will attempt to demonstrate the stages leading to organ and tissue donation. Mr. Smith is an active retiree who lives in the Gaspé region. He's in reasonably good health, except for high blood pressure, which is being treated by his family doctor. A few hours ago, his wife found him unconscious. It was 6 o'clock in the morning. Mr. Smith was quickly transported by ambulance to the regional hospital. On admission, he's still unconscious and he's paralyzed on the left side. After the preliminary examination, the physician from the Gaspé emergency room diagnoses a significant brain hemorrhage. A respirator is set up to help Mr. Smith breathe, as he is in critical condition. The physician then consults the neurosurgeon on call at a specialized healthcare center. The neurosurgeon agrees to have Mr. Smith transferred to his establishment for assessment and treatment. Transportation by air ambulance is arranged. Prior to Mr. Smith's departure, the physician explains the gravity of the situation to his wife. She agrees to have him transferred to another center. 11 o'clock. The plane arrives at its destination and the patient is transferred by ambulance to the specialized care center. (11:30). Mr. Smith's care is taken over by the emergency room physician at the specialized care center. After a thorough X-ray examination, it is noted that Mr. Smith's brain lesions have increased in size. His condition is deteriorating and is critical. 11:55. Based on gathered information, the neurosurgeon and his team have come to the conclusion that no treatment can save Mr. Smith. The damage to the brain is too extensive. Mr. Smith has suffered an irreversible condition with no hope of recovery or survival. The healthcare team anticipates imminent death. They must now wait for the family to arrive to break the terrible news. 2 o'clock. Mr. Smith's wife and daughter arrive at the hospital. The receptionist directs them towards the family waiting area where they meet the care team for the first time. Using simple language, members of the healthcare team explain what has transpired since they last saw Mr. Smith. The doctors review the tests that were carried out and the care that was delivered to try and save his life. Questions from the family are answered honestly and with empathy. Mrs. Smith and her daughter are told that Mr. Smith will not survive this traumatic event. Mother and daughter are in a state of shock. Only a few hours ago, Mr. Smith was doing fine, and now they're told he's going to die. The family gathers at Mr. Smith's bedside. His wife does not seem to realize the gravity of the situation. She cries a great deal and asks many questions. 3 o'clock. Mr. Smith's condition continues to deteriorate, and he is transferred to the intensive care unit. Once there, he's examined again. Tests confirm that his brain functions are irreparable. His brain has lost its capacity to function and keep him alive. He is brain dead. He will never wake up again. Mr. Smith has passed away. The respirator and medication can keep the heart, lungs, and other organs functioning, but only for a short period. Brain death is a condition that is determined in only 1% of all Quebec deaths. 4:30, the healthcare team meets with the family to announce that Mr. Smith's brain has ceased to function and that he has died. The family reacts strongly, and this is normal. The concept of brain death is sometimes difficult to grasp. Mr. Smith is hooked up to a respirator that enables his organs to function. His body feels warm, and he looks like he's sleeping. The family members are upset and need time to come to grips with the situation. The healthcare team leaves them alone for a few moments, leaving some time for Mrs. Smith to realize that her husband is dead. 6 o'clock. A member of the team returns to see the family, who have managed to compose themselves. They understand and have accepted the fact that he is dead. A discussion on end-of-life options is presented. The topic of organ and tissue donation is raised. Earlier that afternoon, the healthcare team noted that Mr. Smith had signed the organ donation sticker on the back of his Medicare card. Mrs. Smith remembers her husband telling her of his wish to donate his organs after death. She now realizes how important that discussion was, since she is not sure that she would have agreed to listen to their explanations. After looking at his Medicare card and asking a number of questions, she gives her consent to organ and tissue donation. 6:30. Mrs. Smith and her daughter are offered the services of a chaplain who provides attentive listening and spiritual comfort care. This gives them the opportunity to bid Mr. Smith a final goodbye and begin the process of letting go. 7 o'clock. A member of the healthcare team contacts Quebec Transplant. Their mandate is to ensure that the gift of donation reaches those in need in a safe, medically suitable time frame. A coordinator will come to the hospital to evaluate if Mr. Smith can in fact become a donor. She will meet with the family, ask questions relating to Mr. Smith's medical history, explain the donation process, and obtain a written consent for organ, tissue, and cornea donation. Blood tests and other exams are carried out to assess the state of Mr. Smith's organs, rule out the risk of disease transmission, and to choose the most compatible recipient. Transplant teams who will retrieve and transplant the organs are contacted. The organ that Mrs. Smith has agreed to donate will be allocated in accordance with a very strict protocol. 8:30. The exhausted family leaves the intensive care unit after saying goodbye one final time. "11 o'clock. Mr. Smith, still on the respirator, is transferred to the hospital where his organs will be retrieved. The diagnosis of brain death must be confirmed by a second physician who, by law, has no relationship with the transplant team. 2 o'clock. The anesthesiologist advises the Quebec transplant coordinator that an operating room will be available for organ retrieval in a few hours. The coordinator organizes the transportation of the transplant teams to the hospital where the organ retrieval will take place. Volunteer police officers and airlines provide transportation to the hospital. Tissue banks are notified of Mr. Smith's wish to donate his tissues and corneas as well. Patients waiting for a transplant are advised to make their way to their respective hospitals as a compatible organ has been found. Thus begins a period of anguish tinged with hope. 6:45. In a spirit of the utmost respect, the entire team of surgeons, nurses, technicians, and perfusionists prepared to retrieve the organs. 10 o'clock. The organs have been retrieved, and the transplant teams return to their respective hospitals to perform the transplantations. After the tissues and corneas have been removed, Mr. Smith's body is returned to Gaspé. His family will hold a funeral service in accordance with his wishes. Organ and tissue donation does not prevent the family from having an open casket. The 100 or so people who've seen Mr. Smith in the past 28 hours have combined their efforts to ensure that his last wishes were respected, that the process was conducted properly, and his family received support. Mr. Smith's generosity has made it possible to transplant 4 vital organs, 2 corneas, heart valves, and bone tissue. It's important to remember that organ donation happens under difficult circumstances. Only a few patients die of brain death and can donate their organs. If you wish to become an organ and tissue donor, you should discuss with your family right now what kind of care you would like to receive when you are gravely ill or near the end of your life. Confirm your decision by signing your organ and tissue donation sticker. Place the sticker on the back of your Medicare card. You can also call your notary to register your consent onto Québec's Registre des consentements aux dons d'organes et de tissus. By agreeing to donate his organs, Mr. Smith has created a ripple effect by reaching out and giving hope and life to others. A difficult situation has been transformed into a gift of life. This achievement is rooted in a society that shares common values. One that is perpetuated by donors, their families, and a team of dedicated healthcare professionals who make it possible for recipients to enjoy a new lease on life.